Now, today is the World Hepatitis Day, a day set aside by the United Nations Organization to raise awareness on the global burden of the viral disease. According to the World Health Organization, over 350 million people are living with viral hepatitis, and it accounts for over 1 million annual global deaths. In Africa, the global health body estimates that more than 91 million Africans live with the deadliest B or C strains, and Nigeria accounts for 19 million of the figure. The theme of this year's commemoration, Bringing Hepatitis Care Closer to You, seeks to bring hepatitis care closer to primary health facilities for the public to have better access to treatment and care. Hepatitis is an inflammation of the liver which can be prevented through the use of sterile injections, safe sex, vaccination, among others, with a global target of 2030 set by global partners to eliminate the disease. Consultant gastroenterologist, National Hospital Abuja, Dr. Agnes Felix Udo joins me for more. Thank you so much for joining us on the news this hour. There is one thing for you to seek care for hepatitis, another thing for you to be aware of this. More than 19 million in Nigerians who are carrying this disease. How much would you say they are aware about this disease to start with?
Thank you for having me at this news session. The truth is, a lot of people are still not aware of their hepatitis status. Out of the 19 to 20 million of Nigerians who are living with hepatitis B and C, only about 10 to 20% of people actually know that they are positive for this disease. So a lot still needs to be done about awareness when it comes to chronic hepatitis B and C in Nigeria.
How do you get to know that you are suffering or you're carrying this virus? And what would you suggest that people, especially when it comes to their lifestyle, to guard against contracting this virus?
The truth about it is that a large majority of people who are positive for these viruses do not show any symptoms. And so it is very easy for people to go on living their lives thinking they are very well and nothing is happening to them. And not until complications arise and the disease is far gone before people go ahead to seek medical help, by which time it might be too late to do anything positive for them. It is advisable that every adult, every human being living should have their hepatitis tests done. Screening is available for both hepatitis B and C, which are the main cause of chronic liver disease and complications. So we advise everyone to go and get themselves tested, whether you feel ill or not, because by the time you start to feel ill, it might be too late to do anything for you. Right, there are other practices. So having tested negative for hepatitis B, we are advised to take the vaccination. For children born now, the vaccination is added to the immunization schedule. So it's assumed that every child born
Well, I'm afraid we had a connectivity issue with a consultant gastroenterologist in National Hospital Abuja, Dr. Agnes Felix Udo. Thank you so much for that. We hope that Nigerians will definitely take this opportunity to screen themselves of hepatitis, different variants.